Guys, before we begin with this segment where Gaurav will start with the questions, we just like to introduce Dr. Goenka. He has done his MD in medicine and is a cardiologist. He is also the founder and director of Chirayu Medical College. Hello, doctor. Thank you so much for being a part of this podcast.
And I'll just jump right into the questions. I'm sure you're very busy. But what is the main reason for Chirayu's low mortality rate?
COVID-19 is not a, simple viral disease. Till today, we don't have any vaccine for COVID-19. Till today, we don't have any antiviral proven effective medicine for COVID-19. In absence of, a vaccine for COVID-19 and in absence of a specific antiviral to be given to COVID-19, the options left with the professionals, the health workers of all over the world is to see what COVID-19 does to different organs of the body. We need to identify actually what are the major organs which are life-threatening by this COVID-19. And that is the main issue of the treatment of COVID-19, that we need to manage different organs by identifying them, what harm they have created to the different organs. Suppose we talk about cardiac, so we see that they can produce myocarditis, and in that form they can produce atrial fibrillation, ventricular tachycardias. So we need to see that we put them on early onto cortisone therapy so that we don't lose a single patient because of this myocarditis and subsequent that rhythm disorder which it can produce. We look at liver, that they can produce acute hepatitis and terminating into hepatic failures. So in case if we pick up early that what kind of bilirubin OTPT values are raised, we are in a situation that we don't put them onto those drugs which can further damage liver. And by that, we can, pick up early the things what further the COVID-19 can deteriorate. Similarly, if we pick up an kidney, acute renal injury, by putting them onto urea creatinine values, putting them to proper hydration therapy, and in case required for acute intermittent dialysis, there is an excellent response in this acute renal injury, and by which we'll be saving number of patients for COVID-19. And if similarly we look to the electrolyte imbalances in the form of hyponatremia and hypernatremia, in the form of hypokalemia and hyperkalemia, and correct them at the right time, which is a usual intensive critical care management. We are again saving few lives because of these electrolyte disturbances of old persons. We can manage them properly. We look to the diabetes, a comorbid condition of COVID-19, and if we, in case we can put them onto sliding scale methods of giving small acting insulins, will not allow these patients to go into hyperglycemia, diabetic ketosis or diabetic ketoacidosis. And in the mannerism by which we will do this, we'll be saving the comorbid patients suffering from COVID-19. We look to the smaller complications first, like temperature. In case the patient has got fever to the tune of 105 and 106, the patients get actually a sunstroke in an admitted hospital. So if you are in a position to give ice water enemas to these patients, if you are in a position to do ice bandages to these patients, we'll be saving them from those 105 and 106 temperatures. And indirectly, by managing all these smaller parameters first, we'll be decreasing our mortality rates for COVID-19. Similarly, we look for the complete blood picture counts, in which if the hemoglobin is less, you give some blood transfusion. If platelets is less, you put them onto some platelet transfusion. If prothrombin time index is poor, then you give them fresh frozen plasmas. And if there is an early infection caught by total and differential count, put them onto antibiotics without looking that they are going to get infected and they are going to get sepsis, septicemia, multi-organ dysfunction or shock, you treat them early onto good amount of antibiotics, you'll be able to control their infection. If you are able to see platelet aggregation, then you are in a situation to put them onto low molecular weight heparins and save them from a complication known as disseminated intravascular coagulation. So by treating the complications of COVID-19 in the tune of hyperpyrexia, in the tune of acute renal injury, in the tune of acute hepatic injury, electrolyte imbalances, hyponatremia, hypernatremia, hypokalemia, and plus if you are in a position to control their infections on priority, if you are able to control their thrombosis by not getting platelet aggregation and putting them onto a proper hematocrit value so that hemoconcentration doesn't happen, I'm sure by managing this hyperglycemia, diabetic ketosis and acidosis of comorbid condition, you reduce your mortality rate to a significant values where only you have to manage now COVID-19 with hypoxia and COVID-19 pneumonia. If COVID-19 mild to moderate pneumonias can be very well managed by early oxygen therapy in the form of 4 to 6 liters or 10 to 14 liters per minute, the question of the mortality comes only for severe pneumonias, which are only 3% of the whole COVID pneumonia. And in case if you are in a situation to, save these 2% of the severe pneumonias, 1% of the severe pneumonia having cytokine storms, even if you are not in a position to manage them at this stage, you will have a lesser mortality overall of COVID-19, which should be less than 1.5%. And the world data says that it should be less than 2.7%. And by the grace of God, Chirayu Medical College happens to have a mortality rate of 1.43%.
That's really nice, sir.
Doctor, you mentioned the use of plasma therapy, and Chirayu Medical College is one of the few hospitals in the country which is running these trials. How successful has it been?
What I had mentioned was not convalescent plasma therapy. What I had mentioned was a poor prothrombin time index in which the PTI was reserved, in which you were subjecting the patient to get fresh frozen plasmas which are stored in the blood banks by component blood banking system. You are talking of convalescent plasma therapy, in which the convalescent plasma therapy is a patient of COVID-19 who becomes RT-PCR negative after 28 days and is willing to give his blood or plasma to any other patient whose hemoglobin is more than 12.5 grams, whose proteins is more than 6 grams, whose HBsAg, HIV, HCV, trypanosoma pallidum antigen test and malarial test is negative in blood and has a good vein in his hand, is a good plasma donor to give plasma. This plasma, which is received after subjecting the patient to apheresis machine, can be given 200 ml on first day and 200 ml on one alternate day to the similar patient who is in need of COVID-19 moderate pneumonia infection. The trial is still going on. It has got some ethical issues for which these things should not come into media, because any trial of medicine has an ethical issues in which no doctor or no hospital should talk about convalescent plasma therapy.
Gaurav, your next question.
Yes, sir. So we spoke of the treatment and it's still ongoing, but what about a vaccine? What is the closest thing we've reached to a vaccine?
Today, it is 7 months of COVID-19 virus. And WHO has declared it as a pandemic. It has reached to hundreds of countries. The nature of the COVID-19 virus, the character of the COVID-19 virus has not changed in any country. So all over the world, the character of the virus or the nature of the virus is same. So the whole world is very hopeful that some of the scientists will be in a position to develop a good vaccine for the humankind. Because till today, in 7 months' time, there is no mutation seen till today, at the time when we are talking about. There is different chains in which people have said that a different chain has a L chain and different chain has a D chain. But both the chains do not stop from developing a vaccine because the character of the virus is same all over the world. In case if it continues, say for about next 3 to 6 months, that the mutation doesn't happen into this virus, the world, the human mankind, the 650 crore people should have a very positive feeling that over a period of next few months or year, the vaccine will come.
That's great news.
That's great.
Thank you, doctor. And so, any message you would have to the general public that they should know about the virus?
You know, this COVID virus has come from animals to human mankind. Okay?
Yes.
And once this has come, so this is going to stay with us forever, because any pandemic, any virus doesn't end so fast. If you remember that polio had come 450 years back, and after the development of that oral vaccine, Do Boond Piyo Aur Bacho,
yeah,
uske baad it took 450 years for the world to get eradicated by polio virus pandemic. HIV, which started in 1979, is still there. H1N1, swine flu is still there. Influenza virus came into 1918, 1920, 100 years back, which killed about 1/3 of the population. But because there was a mutation, that influenza virus is still there. So this pandemic, coronavirus, COVID-19, is going to stay with us forever in life till you really have an eradication by developing a good vaccination for 650 crore people. It will take a long time. It will take a long time. So any virus which is going to stay with us, you should love COVID. You should love coronavirus. You should not be away from it. You should not run away from it. Rather, you should love your COVID virus. Try to know more and more about it. Health professionals should act very fast upon it. Fight with this coronavirus for this society. Rather than running from this COVID virus, it is important that you love COVID. Find out the solutions of it. Find out how do you stay with the COVID over a period of years. And that is the only answer for the human mankind, to continue with all the economic activities, with all the health professionals to run their non-COVID patients. It is a community spread. So you need to know more and more about COVID. And unless you have an affection for this virus, you will never come to know what it is, what it can do, how it is, how you save yourself, how you save the society. So the message is that you love COVID.
That's very different. We never heard that. Yes.
That's a different
Thank you so
way to put
much
it.
for giving us your time. And we want to congratulate you on 4th. Yes, sir. And we would like to congratulate you on 1st of June, because Chirayu Medical College became the most successful hospital in the country. So thank you for heading the hospital. Thank you for your service.
Thank you, Hag. Thank you all.